Bismillahirrahmanirrahim. Assalamu alaikum and hi my friends. As we have started the series of eye, and now in this series we have reached to the chapter glaucoma, which is very important chapter, okay? So what is glaucoma? Glaucoma, it is a progressive optic neuropathy which is associated with optic disc changes and visual field defects, okay? So this is the optic neuropathy, progressive optic neuropathy, optic nerve disorder, okay, which is associated with optic disc changes and visual field defects. This pathology is occurring most commonly in increased intraocular pressure, okay, when there is the pressure inside the eyeball is increased due to the fluid present in the anterior chamber and posterior chamber called aqueous humor. When due to this aqueous humor, when it causes increased pressure, then it is causing this pathology. So increased intraocular pressure is the most common pathology. That's why first of all we will discuss the structure which produce this fluid. We will discuss the drainage mechanism and the properties of this fluid, okay. So it will make us easy the diagnosis and the treatment of glaucoma. After this we will then go to the glaucoma, its types, its subtypes with varied details, with pathogenesis, clinical features, diagnosis and treatment, okay. So what is the structure which produces this fluid? This is the ciliary body, okay. The ciliary body, it is the interior portion of the middle layer of the eye, the choroid, okay, the middle layer which is called choroid or uveal layer. It is the interior part. It starts from, this is the retina, okay, this is the retina, okay, this is the retina. So this ciliary body, the retina, where the retina ends, this is called ora serrata. So from the ora it starts, the ciliary body starts from the ora serrata up to the iris root, okay. So it starts from the ora serrata up to this iris root. This is the interior portion of the uveal layer which is called ciliary body. As if I take the ciliary body outside, this is the zoom portion, okay, if I take it outside. So what is the structure of the ciliary body and what are those structures which produces the aqueous humor? The ciliary body has two portions. It is about 6 millimeter in width, okay, it is 6 millimeter in width. The posterior two-third is called, this is 4 millimeter, the posterior 4 millimeter of this 6 millimeter, this is called pars plana. In the interior portion, this interior 2 millimeter, this is called pars plicata, okay. So pars plana and pars plicata, okay. The ciliary body is mostly made up of ciliary muscles, and we have three types of ciliary muscles, okay. In the entire ciliary body we have three types of ciliary muscle fibers. We have the longitudinal fibers, okay, we have the circular muscle fibers, and we have the radial muscle fibers, okay. If this is the longitudinal muscle fiber, this will be the circular muscle fiber, okay. And then we have the radial muscle fiber. The radial muscle fiber like this in the radius palm, okay. So we have three types of ciliary muscle fibers of this ciliary muscle, okay. Now this is the main composition of the ciliary body, and this ciliary body is surrounded by double layered epithelium. The interior epithelium is called the pigmented epithelium, okay, and the outer, this bluish layer, this epithelium is called, this is the non-pigmented epithelium. So pigmented epithelium and non-pigmented epithelium surrounding this ciliary muscle. As for our concern, we have to focus on the production of the aqueous humor. So this is the interior 2 millimeter pars plicata. It has finger-like projections, okay. It has finger way about 70 to 80 finger-like projections which project into the posterior chamber. These finger-like projection, a lot of finger-like projection, these are called ciliary processes. Okay, so these are the ciliary processes which produces the aqueous humor. These ciliary processes, they are mostly made up of fibrovascular core. This is the fibrovascular core, okay, which is surrounded by this double-layered epithelium. So this double-layered epithelium, fibrovascular core, this projection is called ciliary processes. And these ciliary processes are the factory of this aqueous humor, okay, they produces the aqueous humor. So we have the interior 2 mm pars plicatum. It is a thick portion, okay, it is a thick portion and vascular portion which has these ciliary processes. The posterior 4 mm is a thin and relatively avascular structure which is called pars plana. The importance of this posterior structure, this thin posterior structure, okay, its importance is that we entered during the operations, we entered into this posterior chamber through this part, okay, through this pars plana part, okay, because of the it is a relatively avascular structure. Okay, it is located from the limbus, it is about 3 to 4 mm, okay, this is the limbus, okay, this is the limbus, so it is 3 to 4, 3.5 to 4 mm. When we move from this limbus, then this is located, okay. This is the important state. We entered into the posterior chamber to pars plana because of this is a little bit a relatively avascular structure. So this was about the ciliary body, its composition, okay. Now, as the main part, the pars plicatum, the interior 2 mm and thick vascular part which has ciliary processes produce the aqueous humor by two mechanisms. We have the active production, okay, which actively produce the aqueous humor, and we have then passively production, okay. This aqueous humor can be produced actively. This double-layered epithelium, okay, this double-layered epithelium use energy and actively produce up to about 80%, okay. So 80% of the fluid is actively produced into this chamber, okay, into this posterior chamber, okay, and 20%, about 20% fluid, they are produced passively, as due to the pressure and due to the osmosis, 20% of the fluid is produced passively without any energy, okay. Now, as the fluid are producing by these ciliary processes, so they will come through this pupil to the interior chamber, okay. So this fluid needs to drain from this interior chamber because of the constant production, and to maintain a normal intraocular pressure, this fluid needs to drain from this interior chamber. For this we have the drainage system, and this drainage, like this production, is also of two types. This drainage of fluid can be through trabecular meshwork route, which is the main route, okay, the main drainage system, and we have the uveoscleral route. So what is the trabecular meshwork route? We have the trabecular meshwork drainage system, which is the main drainage system, okay. It is made up of several structures. We have the trabecular meshwork, Schlemm canal, intrascleral aqueous veins, and we have the episcleral veins. So the trabecular meshwork, the first structure is the trabecular meshwork itself. What is trabecular meshwork? Trabecular meshwork, at this interior chamber angle, we have a sieve-like structure. A sieve-like structure, a perforated structure, which is called trabecular meshwork. Okay, if we zoom it, it is the trabecular meshwork, okay. So this is the interior chamber, and this is the perforated structure at this angle. This is trabecular meshwork, which is composed of three parts. The first part, the black one, this is called uveal part, as it start from the interior part of the ciliary body. That's why it is called the uveal part. Okay, so it start from the uveal part and up to and extend up to the descemet membrane. Descemet membrane as the endothelium, when the corneal endothelium, when the corneal descemet membrane, as we have discussed previously in the chapter of cornea, it terminates in a prominent line in this region, which is called Schwalbe's line. Okay, so this Schwalbe's line from this interior part of the ciliary body to the Schwalbe's line, this is the uveal part. From the scleral spur, what is scleral spur? When sclera comes right over here like this, it form a projection into the interior chamber angle. Okay, this is the interior chamber angle, so it make a projection to the interior chamber angle. This projection of the sclera, this is called scleral spur. Okay, so from this scleral spur up to the Schwalbe's line. Okay, this is called corneoscleral part, as it start from the sclera and terminate at the cornea, so that's why it is called corneoscleral part. And then we have the last portion of this perforated trabecular meshwork, which is the juxtacanalicular part. This juxtacanalicular part, it connects this other trabecular meshwork parts to the Schlemm canal. What is Schlemm canal? Schlemm canal is a rounded or oil-shaped canal around this interior chamber. Okay, this is the interior chamber. Okay, so around this interior chamber, we have this Schlemm canal. Okay, this is the Schlemm canal. So around this interior chamber, we have a rounded or oil-shaped canal, which is called Schlemm canal. And as I told you that when the sclera comes right like this, it forms a projection into the interior chamber. So this projection is also associated with the formation of a groove. Okay, there will be the formation of a groove-like structure in the sclera. This groove-like structure will be extended around this entire 360 degree of the interior chamber angle. This is called the Schlemm canal. So the last part, this juxtacanalicular part, is this connecting this other parts of the trabecular meshwork to this Schlemm canal. Okay, so the trabecular meshwork then drains into the Schlemm canal, intrascleral aqueous veins. As the Schlemm canal is now drains into the aqueous vein, into the veins of sclera. We have veins in the sclera. Okay, we have veins in the sclera, and these drain this aqueous humor. That's why they are called aqueous veins. And these are in the sclera, so they are intrascleral aqueous veins. Okay, they will drain this fluid. Fluid will come through this trabecular meshwork into the Schlemm canal, and from the Schlemm canal they will drain to these intrascleral aqueous veins. Ultimately, these scleral veins will then drain into the veins, the episcleral veins. Okay, so these intrascleral veins will drain into the episcleral veins. Okay, so this is the main drainage system at the interior chamber angle. Trabecular meshwork, which has three parts. This perforated trabecular meshwork drains into the Schlemm canal, and the Schlemm canal drains into the intrascleral aqueous veins. Ultimately, this intrascleral aqueous vein will drain into the episcleral veins. Okay, remember one more thing, that the pressure in these episcleral veins, it is about 5 millimeter of mercury less than this intraocular pressure. Why? This is because it is important, as when the pressure is less in the episcleral vein, so the fluid will easily drain into these episcleral veins. Okay, so this was about the production of the fluid and the drainage of the fluid. But remember why before the glaucoma, why should we know this structure, this mechanism, this drainage? Why? This is because any problem with the production or with the drainage system will cause increased intraocular pressure, and hence it will cause glaucoma. Okay, so it is important. concept you should know, which is important for the diagnosis of glaucoma, is the interior chamber angle. What is interior chamber angle? As I discussed before, this is the interior chamber angle. If we move from the interior to posterior, so interiorly it starts from this Schwalbe's line, okay, Schwalbe's line, then trabecular meshwork, then the scleral spur. The third and the fourth structure is the interior part of the ciliary body. So Schwalbe's line, trabecular meshwork itself, scleral spur, and then the interior chamber angle. This is called interior chamber angle, okay. The interior part of the ciliary body, okay. So this is called interior chamber angle, and which will be discussed what is the importance of this in glaucoma, okay. So remember this. Now, lastly, we should know the properties of the aqueous humor, okay. Aqueous humor, it has a refractive index of about 1.33, okay. So we have 1.33 refractive index, and its production per minute is about 2 to 2.4 microliter, okay, per minute is the production of this fluid from these ciliary processes, okay. And the volume, the entire volume in this posterior chamber, in interior chamber, it is 0.30 ml, okay. And remember, 99.9% of this aqueous humor, this is entirely liquid without any solid component, okay. So 99.9% is liquid, okay. And the proteins and the glucose component is less than the plasma. But the ascorbate component in this aqueous humor is about 30 times more in the aqueous humor than plasma. Although the glucose and the proteins level, they are less, but the ascorbate level is 30 times more, okay. So it has a unique composition. And now this interior chamber fluid, this aqueous humor, maintaining a normal pressure of about 10 to 21 millimeter of mercury. It is a normal pressure which is important for the normal corneal circumference and for the normal ocular structure and for the normal vision. So 10 to 21 millimeter of pressure, the average pressure becomes 16 millimeter of mercury, okay. So these are the properties: the refractive index, its volume, its production, its composition. And this was about the drainage system. And remember, at last, as we discussed the drainage, the main drainage system, the trabecular meshwork drainage system drains about 80 to 90% fluids, okay, 80 to 90% fluid, and the rest 10 to 20% fluid is drained through the uveoscleral route. What is uveoscleral route? As the fluid is mainly coming to this posterior chamber and then drains to this interior chamber angle through the trabecular meshwork, okay. But 10 to 20% fluid also move into the same structure to the ciliary body, okay. They move to the ciliary body, the choroid layer, and then drains through the choroidal veins and episcleral veins, okay. Again, this fluid will come to this ciliary body in the choroid layer. In the choroid layer, in the suprachoroidal space, we have episcleral veins. So these fluid will be drained through these choroidal vein and episcleral veins in a reverse route, okay. This is called uveoscleral route. So this was about the structure, the mechanism of production, the drainage of the aqueous humor. Nextly, we will discuss the glaucoma, the types, its subtypes in very details, okay. I also have prepared notes. I will give you the link in the description. You can go through the notes and can learn more. Thanks for watching the video.